We are live. Good day, everyone. Yes, we are back again with Insights webinar. Welcome to the 34th edition of the Insight webinar series, proudly hosted by eHealth Africa. This is a platform that brings together leading public health professionals to share knowledge, discuss critical issues, and of course, explore innovative ways to strengthen healthcare delivery in Africa. My name is Joyce Shingi, and I'll be your moderator for today's exciting discussion. The last time we met was in June, and in July, we hosted the Insights Learning Forum 2025. It was very powerful. We had bold panel sessions, thought-provoking presentations, and deep discussions on why local investment in digital health can't wait. This month, we're going to be taking the conversation further and focusing on the urgency of local investment in health and communities. Here in Nigeria, almost 70% of digital health funding still comes from external sources. But without strong homegrown financing, many of these initiatives struggle to last. Today, we're going to be exploring how we can change that story together. And that is why in this edition of Insights webinar, we're taking bold steps to push the conversation forward on accelerating local investment in digital health. Once again, I warmly welcome you to Insights webinar. Please don't keep this to yourself. Share the link, invite others to join this important conversation. Now, moving on. Today's panelists are important partners who have supported advancement of digital health solutions. The first panelist for today is Dr. Lare Aliyu Tambuwal. She is the Executive Secretary of the Sokoto State Primary Healthcare Development Agency, where she leads the development of routine immunization, disease surveillance, maternal and child health, and other primary healthcare services across the state. She also serves as the World Health Organization Assistant Public Health Officer in Sokoto and the WHO State Technical Assistant for COVID-19 vaccine introduction and rollout. Dr. Tambuwal played a central role in Sokoto's COVID-19 response, supporting the incident management system, overseeing vaccine procurement, micro-planning, and rollout, while at the same time also ensuring the continuity of essential services and, of course, addressing vaccine hesitancy. She supervised the state's COVID-19 seroprevalence survey and coordinated independent monitoring of vaccination campaigns. With more than 20 years of experience, Dr. Tambuwal has also worked extensively with WHO in Sokoto, supporting polio eradication, social mobilization, and maternal and child health programs. She has also served on Nigeria's national medical team for Hajj operations. Dr. Larai, please say hi to the audience.
Assalamu alaikum.
Okay. Thank you. Moving on, we have Mr. Afeez Olajire. He is the managing partner and CEO of ACE Strategy and Consult Limited. Mr. Olajire is a consummate management consultant with over a decade of experience in health system strengthening and international development. As the managing partner and CEO of ACE Strategy and Consult Limited, he supports governments, donors, and organizations to design and implement innovative, context-specific solutions that drive sustainable impact. He has led high-level projects in health financing, digital health, and supply chain management, amidst several others. He has also served an array of global and local clients across donors and governments, including the Gates, Aliko Dangote Foundations, Gavi, World Bank, and key sectors within the government. He has also led several global and tailored solutions, including he designed the homemade complementary feeding initiative in Africa, supporting the development of Nigeria's ODK system for vaccine stock reporting, now being adapted across other LMICs, as well as developing accountability framework for Southeast Asian countries, which is going to help them, help them to prepare for transition from Gavi funding across several solutions that disrupt conventional thinking. He holds a master's in public health from the University of Ibadan. And of course, he's very passionate about sustainable health solutions. Afeez continues to champion locally driven investments and innovations to build resilient tech-enabled health systems. Mr. Afeez, please say hello to the audience.
Hey everyone, good to be here.
Good to have you here too. Thank you, Mr. Afeez. And last but not the least, we have Mr. Opeoluwa Olajuwon. He is a senior supply chain analyst at Chai, Nigeria. Mr. Opeoluwa is a pharmacist and digital health system analyst with experience in advancing data visibility and system integration within Nigeria's immunization supply chain program. He supports the deployment and optimization of platforms like OpenLMIS and DHIS2 to strengthen vaccine logistics. He has been very instrumental in deploying interoperable solutions using OpenHIM, enabling data exchange across critical domains, including stock management, cold chain equipment, immunization service delivery, and product registry systems. His work directly supports last-mile visibility and informed action in vaccine logistics, ensuring timely distribution, minimizing wastage, and enhancing program accountability. Please say hello to the audience, Mr. Opeoluwa.
Hi, everyone. Good to be here.
All right. Good to have you all. Before we kick off, let's watch this short video highlight of the Insights Learning Forum 2025. Help desk, please take the floor.
Today we have a gathering of stakeholders from the private sector, from government, from development partners, innovators, who are co-creating solutions that help to enhance data integration, data surveillance, issues around scale, so that we strengthen our ability to use data as an important enabler to help achieve the country's priorities.
Put your hands together as we make welcome the Director, Partnerships and Programs, eHealth Africa, Miss Ota Akibe.
This year's theme, like TJ Sue and Daniela have said, is local investments for connected communities. And we do appreciate the external funding. It has done so much. It has moved the needle significantly. But we need to come to the point of advancing the ownership that we're already seeing, because we need to make sure that these interventions, these initiatives, these innovations, they last. So what we mean by local investments is that sense of ownership. Investment there goes beyond funding. We talk about leadership, being accountable, investing in the leadership of the innovations that we have. We talk about using what we have here, creating ideas locally that we can eventually even export more efficiently.
I think it's a very timely theme because health equity will first be won at the community level. I like to say that we are not well until all of us are well, and thinking about how we invest in local communities to drive that is paramount at this point.
It's not just about building tools, not just having users input anything into the system, but having some check and balances. So putting validations in place in your system and also ensuring that you would have a robust human capacity building would help us solve that issue.
The solution is just as useful as the end user, who are the one that we should prioritize as we conceptualize all our ideas.
There's a lot to be done. Everything starts with innovation and entrepreneurs. So bring out your ideas. I would encourage everyone to bring out their problem-solving skills, especially the young generation that's coming up, the young innovators. They are the future, and we would love to see how they can use the innovation not only in I would say in the e-commerce sector or in the private sector, but also in the health sector. There's a lot of problems to solve, and ideas are welcomed. And as EHA, we spearhead with innovation, and we always listen to new innovators. So we just encourage people to keep innovating in the health sector specifically.
There needs to be a plan to continually build the capacity of the health workers.
We can keep talking out here, but the people that are being affected, they're out there.
What is important is the leadership and the willingness to move ahead on this.
And we must do these co-creations.
Quite refreshing, quite insightful, quite packed with a lot of resource material and resource persons. They've just buttressed the point of being in a connected society. And it's also enlivening to know that you can actually partner to get all you want, funding, technical know-how, and a lot.
Collaboration is the new innovation, and for that's where we should start. As both stakeholders, whether you're a developer, whether you're a funder, whether you are an implementer, that is very critical. And government needs to further work with all the sectors, especially private sector, to create the level of enabling environment to be able to drive and unlock potential funding for young people out there to be able to make that change.
My takeaway really for this year's ILF is stepping away from asking if digital health matters. We know it matters. We know it can scale access. We know it can expand access to the most difficult places. But how do we ensure that we are moving forward intentionally to design, finance, and deploy those systems to scale?
We have the vision of seeing this become more of an international forum that has started from Abuja and to grow within Abuja, and for us to eventually see more international, hopefully partners and governments attending the ILF. So we plan to have this every year, and we just look forward on how we can have more collaboration and have more insights from everyone.
Thank you, HelpDex, for that wonderful video. I hope you all enjoyed the video highlights from the insights from the just concluded Insights Learning Forum 2025. Before we continue, I would like to announce that eHealth Africa is open to welcoming partners for next year's Insights Learning Forum. To learn more, you can visit www.insightslearningforum.org. I repeat, to learn more, you can visit www.insightslearningforum.org. Once again, I want to appreciate all the panelists and their organizations for your various contributions to the success of ILF. Now, let us move to the panel discussions proper. Mr. Okbeoluwa, please confirm if you can hear me. Okay. You supported the Insights Learning Forum, which was focused on local investment for connected communities. I would like to get your perspective on what inspired you to lend your support to this initiative. Mr. Okbeoluwa?
Thanks, guys. For us, I think it was a case of natural alignment in BRC. The focus of the ILF conference was on local investments for connected communities, and this perfectly echoes with CHAI's commitment to locally owned digital health systems. And in CHAI, we believe strongly in sustainability, and we know that local investments are a strong way to ensure that happens. So yeah, that was one of the reasons why we had to support the conference.
All right. Thank you so much, Mr. Okbeoluwa. Mr. Afiz, I would also like to get your perspective on what inspired you to lend your support to this initiative.
Thanks. I think I have a very similar response to what Dr. Lu had said. So for us, it's just resonates so well with us. It's like helping us move from technology hype to actually focus on the sustainability, ownership, and collaboration. Because for too long, digital health has been treated like some external project or a big buzzword. But the platform that eHealth championed during the ILF helped us bring everything together. It championed a shift where the donor, the community, the local government, and even the private sector are now seeing digital health as our own internal responsibility and not just some external project.
Okay, thank you so much, Mr. Afiz. I agree with you that, for the longest of times, digital health has been treated as just a buzzword. Now, for this reason, I would like to, get the ideas on why you think the topic about local investment in digital health, which has been treated as a buzzword for the longest of times, is crucial at this point in time. We're going to start with Dr. Larry. Dr. Larry? Okay. Dr. Larry, can you hear me? Okay. I'll be moving this question to Mr. Opeolua. Why do you think... Can you hear me?
Yes, I can hear you guys.
Okay, all right.
Okay,
All right.
I guess, should I go ahead?
Yes, please go ahead.
All right. I think for
Okay. The sustainability remains with us as Nigerians because we cannot continue to be spoon-fed. We have to stand on our feet and see that we own it and we finance it and we also sustain it. In that way, it will not be just a buzz. It will be a self-owned program for long term to sustain. And we are also understanding from that workshop that digital health, digital tools usage is no more optional. It is an essential item and commodity if we are to tidy up the health system so that we deliver equitable health services that will give us universal health coverage. I think I will stop here.
All right. Thank you so much, Dr. Larry. I'll show Mr. Opeolua. You can continue from where you stopped.
All right, thanks, guys. For me, I think, yeah, we are actually at a turning point right now, looking at the current public health landscape, funding and all. And if you ask me, many countries, including Nigeria, already have the building blocks for digital health. We have digital platforms already established. We have data systems. You even have trained people that already use this platform. But one thing has always remained a challenge, which has been sustainability. And I think with local investments, we can actually convert these gains that we already have in digital health into not something temporary, but something permanent. With local investments, we're able to align our digital health with national priorities. We're able to unlock even partnerships with the private sector. I think someone even mentioned it during the ILF. So for me, in short, local investments would move us from a place of dependencies to a place of self-reliance. And I think with this, we could actually have digital health that truly delivers equity and can scale. So yeah, I agree that local investment is crucial at this point.
All right. Thank you so much, Mr. Opeolua. Mr. Afis would also want to hear from you. Why do you think this topic around local investments in digital health is very crucial at this point in time?
I think, in addition to what has been said already, is we're at a point where, just like everyone has rightly mentioned, we're at an inflection point where we all need to understand that we cannot continue to rely on external help to solve our own problem. So local investment at this point is important because it helps us guarantee sustainability as well as resilience. We cannot expect an external person to be the one to champion a cause that affects us directly. So with the local investment, it allows local ownership and it ensures that everything we are curating is aligning with our own local context and the community need.
Okay, thank you so much, Mr. Afis. From everything everybody was speaking about, I could tell that, one of the key things here is sustainability. And, when you're talking about local investments, what usually comes to the mind of people is, money, money, money. So, Mr. Opeolua, can you shed more light on what, local investment in digital health is really all about?
I think just like you said, it's very important actually that we stress that local investment actually go far more than just allocating financial resources. And yes, I think financial resources are actually key, but for true local investment, it's much more broader. It's one about investing in our people, ensuring that we create even civil service roles for data stewards, product managers, and even healthcare workers that are digitally savvy. And in that case, ensure that they remain part of the system, especially when project cycle ends. Because what we would see most times is you have someone employed for a particular project, and after the funding of that project is completed, that person goes with the project, and you then have a system that you really do not have someone supporting and maintaining it. It's also about even investing internally in standards across the country, ensuring that we have data registries, we have data dictionaries, and even if possible, have shared patient record registries that can then promote interoperability between two systems. It's about building infrastructure, ensuring that we have laws that protect even our patients and compliances with standards. And if I'm going to even talk about the financial part of this, of local investment, it is also a place where we have to make a distinction between donor fundings and what we call local investments. For donor programs, we rightly know that they most likely operate in a 3 to 5 year cycle, and most times when this cycle ends, some of the systems even sometimes falter. But with local investments, like I earlier said, we can then now embed some of even our digital health budgets into our own local budgets. In that case, guaranteeing continuity and accountability. Such a way, we have actually started to see examples even in my own field. For some states in the country right now, we have moved from relying on donor support to directly funding our coaching technicians, where when CCEs actually break down in states, we do not wait for donor funders any longer to repair those CCEs. We take the initiative to go ahead to do those repairs by ourselves. And even talking about the present open LMIS project that we are currently managing in the country, we have right now seen some transitions from a donor-hosted infrastructure to a government-managed server, really. And what that means for us is it signals that the government is not just adopting the systems any longer, but they had taken full responsibility for the long-term operation of these systems. And so when I define local investment in digital health, like I said, I don't just see it as financial allocations. I see it as an holistic commitment, really. And with these local investments, we're able to send a message that digital health, just like Mr. Afis have said, will no longer be a donor-driven private sector experiment, but it would be part of the country. And with this, we can see with it that our health systems will start to evolve.
All right. Thank you so much. That was quite extensive, Mr. Okbeoluwa. Don't forget to drop your questions in the Q&A box. From what Mr. Okbeoluwa spoke about here, we can see that local investment is more than just, finances. It also means investing in our people. So, Dr. Larry, why do you think that the higher percentage of investment comes externally?
Well, when we talk about investment, it doesn't mean only financial investment like you've mentioned. It means that every stakeholder contribute their own quota, from government to private partners to developmental partners to the community members. The common community member, he has something to contribute. And well, we observe that most of the time, if we are making investment, the mega share comes from external sources. This is because, first of all, sometimes the fiscal space wherein the government contribute from taxes, from revenues, is constrained. And by the time the contribution comes, there is a lot of debt that is for the system, as well as there are competing priorities. Sometimes you look at infrastructure, you need to act there. You have training and capacity building for human resource for health. You also have a lot of service provision, logistics, on demand. So this makes the contribution looks small because the sources are constrained. And secondly, we have this global solidarity. For example, we contribute, the donors contribute, but the donors, they contribute based on their GDP. A proportion of their GDP is contributed. And behold, it will be bigger than what Nigeria is going to contribute or any state can contribute. And that's why seamlessly you look at it and you see that the contribution we make locally may be so little compared to what external sources are bringing. And as well, internally, our markets, when you want to engage the private partners, the market is not reliable. There is poor return on social investment, and there is irregularity that makes some of the partners, private partners, to be apprehensive because the market is not reliable. So there is little investment from local private partners. And if you also observe, among all the sectors, when partners, even the global solidarity, want to contribute, there are certain sectors that are favored, like the health gets big share, the humanitarian ministry as well as the environmental ministry. They get the highest share. So when you compare with what is contributed locally, you come to realize that it is small compared to what the external forces are bringing. It may not be small, but compared to what external sources are bringing, it may look small. I believe some of these points have highlighted investment may seem lower than whatever external forces are bringing.
Okay. Thank you so much, Dr. Larry. From what you said, one thing I was able to take away from this is, we have constraints due to debt, conflicting priorities, and the market not being reliable. Mr. Afeez, do you have something to add to this? Why do you think that the higher percentage of investment comes externally?
Yeah, thanks. I think the ES had made a very brilliant point. So I also think an addition could be that, historically, most of our digital health projects were even introduced to Nigeria through donor funding. A good example is the DHIS2 and some other systems. So external investor built the first network for digital health in Nigeria and Africa, if we are being frank. Locally, we know our fiscal space for health is already stretched. So digital health comes like something on the corner, is not a priority. But the good thing now is there is a shift because recently, everyone is now beginning to see a digital health as part of the project and not an add-on to the project. Because what we see before is digital health look like an add-on, like a plus. And that has created some fragmentation. But the good thing now is we are beginning to see it as part of the program, not an add-on to the program. It's not just complementing the program. It's actually part of the program that sets it up for success or failure. So this is creating, all of those created some dependency. And even though those real opportunities for efficiency and scale lies in domestic investment, which is what we all need to know. So I feel the introduction and us taking time to transition from that mindset of seeing it as an add-on, seeing it as an add-on when we should be seeing it as a core part of the program that we implement. I think those are the additional points I'll be adding to what Dr. Lara has already mentioned.
All right. Thank you so much, Mr. Afeez. One key takeaway for me from what you said is that digital health is not just it's part of the program and not just an add-on. So if digital health is actually part of the program and not just an add-on, why then does it seem so difficult for, this investment to effectively yield the expected results? And, how can we then fix this? Mr. Okwe-Oluor, this question is for you.
I guess I will just maybe pick it from where Mr. Afeez actually stopped. I think one of the reasons why digital health projects fail or fail to deliver the expected return is not because of weak technology. We have great digital health softwares and platforms out there, but sometimes it's because of poor planning and weak integration even after the project have started. You see, and sometimes it's also because we develop tools without even real engagement from the people who use them. So we want to develop tools for healthcare workers, but we are not involving them in the process of even deploying those tools. And many times we measure even success rate of these our tools by reporting rates, by the amount of features you have been able to deploy on the tools, instead of really looking at real health outcomes that really drives innovations like reduced vaccine stockouts, improved vaccine coverages. And sometimes I think even capacity might be a barrier. So you have a digital health system that works perfectly, but you had trained some healthcare workers maybe to use it, and oftentimes you see them leave. And when they leave, there is a gap in how the tool is being used. Sometimes you then need to go about retraining healthcare workers, and that is even if you know this is really happening. But I think this is not just about problems, there are solutions. And the first solution that I would really say is we must ensure that the systems that we have designing are co-designed with the end users in mind, that they are practical, they are relevant, and they are aligned with the daily realities of the workers that are going to use this tool. And the second point is about the integration part of this work, that we don't just do systems, or we don't just deploy systems in silos in order we're creating fragmentations. We should look at how systems can talk to each other under one coherent architecture, which really boils down to what I think the National Digital Health Initiative is trying to accomplish, ensuring that all systems, regardless of the levels that they are in, can speak to each other, share data between each other. A patient can go into a clinic in Abuja and still be able to have access to their records from their visits to the states. So with this, I feel we would be able to resolve some of the challenges we have seen about not really getting the outcomes that we had looking for. And like I said earlier, by grounding these projects in national architecture and designing our outcomes in a measurable health system level improvement-wise, we can significantly improve these returns, and we can significantly improve sustainability of our tools.
Thank you, Mr. Okweoluwa. Thank you for, giving us some ways in which we can fix this. Mr. Afeez, I would like to know what are, let's say one or, two specific actions or policy shifts that could help us, encourage more local and private stakeholders to invest in digital health initiatives?
I think two things, just like you said. The first is, I think the government need to now make some intentional efforts to have some dedicated budget line for digital health and create incentives like break or matching fund for private sector investment. I think that is long overdue. We now need to face our reality from all of the things we've read recently, from the funding cuts to the Gates Foundation priority over the next 20 years. One thing is clear. Everyone wants to accelerate how quick we get to the results. And we've all identified that one of the easiest routes to that is for us to move into digital health. So if the global world is moving towards that, and in a country like Nigeria and low middle income country generally, where we are so behind, I think there needs to be that reality shift from the government to have some dedicated line item for digital health. I think that's the first thing. The second thing is that we then need to have some clear interoperability standard so that all the local innovators can actually build a solution that be plugged into the national system with confidence. Okwemi mentioned a very good point about something around EMR, how a patient attending a government facility in Sokoto need to come to Abuja and need to start narrating their medical history. We might just be thinking of the direct implication, but there's a lot of indirect cost attached to that. There is the fact that these patients, the doctor now need to take more time to track the patient because they need to take all of the history. The medical record, the medical investigation puts more burden on. If you are paying out of pocket, it puts more burden on you. If you are using the government insurance scheme, it also puts more burden on the government because the tests they have done in Sokoto, they need to repeat it in Abuja. So we need to already start. So those two policy shifts is one, the budget line, which is around funding. Two is there needs to be some standard where we're having a platform that creates that interoperability standard that every local innovator can always plug into the national system. So as you develop your system, you are developing it within yourself, but there is already a natural system that is plugged in at the national scheme. So I think those are the two immediate shifts that I feel need to happen.
Sorry, I lost my connection.
If we want to encourage the local and private sector stakeholder to want to drive the investment in digital health initiatives. I'll pause here.
All right. Thank you so much, everyone, so far. The discussions have been really, really, really insightful. To the audience, don't forget to drop your questions in the Q&A box. You've all given some, very, very good examples in your explanations. So I would like to key in on this fact, and I would like to ask this question. From your experience, can you share a practical example where, let's say, local leadership or community-driven investment has significantly improved digital health outcomes? Dr. Larry, is it possible for you to speak right now? Okay. Dr. Larry, we can't hear you. All right.
Hello?
Yes, we can hear you now. Okay, Dr. Larry, we can't hear you. While she's sorting that out, Mr. Okpeolua, you can take the floor.
All right, thanks, Joyce, once again. I think for us, I will just use one of the projects that we had deployed in the country, which is the Open LMIS rollout. I can remember when this was rolled out in 2023, one of the immediate challenges that we faced was sustainability. Initially, we had relied on donor fundings to cover the cost of internet bundles for the users of the system. But once we started to see the tapering of these funds, there was a real concern about how usage would continue. And I'm happy to say right now that that's no longer the case. And the reason why it is no longer the case is we've started to see a local investment even from states, and LG is taking ownership of how this tool is being used. We start to see some form of stipends or budgetary allocations towards ensuring that users can get internet data to interact with the system. And this simple but strategic investment removed a key barrier for the system use. And I can proudly say that right now, if we go to look at the system, we see an average of 95% reporting rate on a weekly basis. This was possible because we have the input of local investment into what has initially been built as a digital platform for supply management in country. Thank you.
All right. Thank you, Mr. Okpeolua. 95% on a weekly basis is a very, very high and good rate. Dr. Larry, can you? Okay. Okay. Okay, we can't hear you, Dr. Larry. Okay, Mr. Afeez. Mr. Afeez, kindly take over while she's sorting that out, please.
I think one example that will complement what Okpeolua has said was, I think it was in 2020 when the country subscription to the LMIS2 expired. And the new budget was not something any of the current budget that the country had could fix. I think that's when we see why we need to make some investment in some local investments to drive the real change that we wanted. So I think this prompted everyone to actually come together and use some simplified Excel and ODK system to develop a vaccine stock reporting dashboard deployed from health facility to report to LGA store, to state store, to zonal store, or to the country. And it's quite novel because that is saving some millions of dollars that we have to pay for external support to be able to report our own stock. So which I'm glad when Okpeolua gave his point, because that's giving me the joy of the country has built on that. Because what we did then was basically within our national logistic working group, vaccine logistic working group at the country level, come together, look at people that have aligned skill that could do something locally, built a simple solution that could help us. And in just 2 weeks, we're able to bridge the gap of what will have been a national emergency, because it gave us access to see what stock is available across all levels, also help us achieve increased reporting rates. And overall, in just 2 weeks, we are back online. We are able to see stock data out, stock data at the other level, and stock health facilities that are overstocking or stores that are overstocking, and the need for us to quickly redistribute. So that's one time when I saw the real collaboration between the private sector, the government, and how the development sector, how everyone could come together to use the local leadership, because of course we got the backing of the national and the state government. That's why we're able to use the skills we have acquired locally to bridge that gap in logistic management, information coordination across the vaccine space there. Over.
All right. Thank you so much, Mr. Hafiz. This just goes to show the importance of collaboration between all the sectors. Dr. Larry, is it possible for you to speak now, or should we move forward? Dr. Larry, you're muted. Okay, if you can hear us, we can't hear you, so we're going to be moving. All right, thank you. Okay, Mr. Hafiz, back to you again. What would you then say are the biggest missed opportunities? Okay.
Go ahead.
Okay. What would you then say are the biggest missed opportunities when, local investments are not prioritized in digital health, especially for underserved communities?
I think the biggest loss is sustainability, frankly. That's the biggest loss. Because what happened is communities are then left with short-term projects that collapse once do not exit. It also means the chance to build trust, because when you are starting any project, there is the lens of impact, there is the lens of sustainability, but more important is the lens of trust, where the community see that what you are doing, you have them, and it's not something that is just going to fade off when there is a blip. So the biggest loss, like I said, is sustainability, because when communities co-invest, even with time or local resources, production is stronger and can scale, impact lasts longer. So if they ask me what the biggest missed opportunity has been, it is sustainability. Because what we keep having are one-off wins. People invest, we create a solution, we think is working, do not exit, and we are back to where we started from. So the biggest loss for me is sustainability.
All right. Thank you so much. Thank you so much, Mr. Hafiz. If there's one thing I want everybody to take home today, it's that one of the biggest missed opportunities that we have when local investments are not prioritized in digital health is sustainability, which is a very big problem in the long run. Now, how then can, partnerships between the private sector, government, and of course, development partners be structured to ensure that long-term sustainability of digital health solutions? Mr. Opeolua, do you need me to take the question again? Can you all hear me?
Yes, I can hear you loud and clear.
Okay. All right. So I was asking, right, because Mr. Hafiz spoke about how important sustainability is. So I'm asking, how can partnership between the private sector, the government, and the development partners be structured to ensure the long-term sustainability of digital health solutions?
Question to me?
No. Dr. Larry, are you? Okay, so we still can't hear her. Mr. Okweolua?
Can you hear me now?
Yes, I can hear you.
Yeah. I guess it's still talking about the building blocks that we have spoken about. It's just like everyone needs to pick up the responsibilities that are theirs and do them. For what we've been discussing since the beginning of this forum or webinar, we need the government to build on the standards, something that the private sector will be able to build upon. We need the private sector to then come in to build upon what the government have initially built, something that can plug into a national instance where data is being shared. And I believe that if we are able to do this, long-term sustainability becomes something that is a day-to-day thing that we would see around. It won't just be private sectors building systems in silos any longer. And if we can take an example from the fintech world, we have the NIBSS system that basically powers our transfer ecosystem in country. This is a government initiative. This is something the government has done in partnership with the private sector, and this is what powers all our transfers in the country. If we do not have that particular system, I'm sure maybe most of our transfers will take 1 day or 2 days before we even receive them. But right now, you can do transfers and you get them almost in a heartbeat. So if every stakeholder, private sector, government, and development partners do what is expected of them by building the standards that are expected for this long-term sustainability, I believe we can ensure that for our digital solutions.
All right. Thank you so much, Mr. Okweolua. This one is to the people in the private sector, the government, and the development partners. If we are able to do what we need to do, we can be able to ensure the long-term sustainability of digital health solutions. Dr. Larry, are you able to speak now? Okay. All right, so I will be moving forward. Mr. Afis, what would you say? Yes, what would you say are the strategies that can be, let's say, employed to ensure that digital health solutions are not just donor-driven projects, but that they are also integrated into local and, of course, national health systems for long-lasting impact?
Thanks so much. And yeah, I would say these strategies stand out for me. The first one is the need for us to integrate digital health into national and state health budgets, like I said, because we know that the success of all of this, the backbone is still in financing. So I think that's the first thing. Now we are not just talking financing, we are talking local financing. The second for me is the need for us to enforce interoperability so that tools can connect to the health system rather than sit in silos. In the last 5 years, our problem has not been digital health solution. The real problem is in harmonization, complementarity, and us moving with the same synergy. I think that's the second thing I would say. So interoperability should be a core bit to ensure that nothing is sitting in silo, everything continue to connect to achieve the big goal. And I think the third for me is for the need for us to build capacity. I think for so long, people have need to self-learn digital health. There was a time where all meetings must be in person. COVID gave us a reality check of the need for us to actually be intentional in building capacity on teleconferencing, on a lot of topics. There are people that were using memo back then and now to have to transfer to email. So I think for me, the third bit is to build capacity, because digital health can no longer be something that we are building at the big stage, but we are not trickling down. So it has to be part of both pre-service and in-service training for health workers. Because when we build all of these solutions, some people still need to adopt and use them. So the first thing is to integrate. Second is for us to enforce interoperability. Everyone must key in. Good that the NDHI of the swap is doing that now. And the third is that there needs to be some intentional capacity building during in-service and pre-service training to ensure that all health workers have the required preparation and skills to use these tools when we finally deploy and launch them. I think those are the three things I will propose as strategies that should stand out. Over.
All right. Thank you so much, Mr. Afis. As always, that was quite insightful. I'm able to now know that, the strategies that can be employed to ensure digital health solutions are not just donor-driven, but, integrated into local and national systems for lasting impact are, integration of the digital health into the national and the state budget, intentional capacity building, and of course, enforcing interoperability. Now, any final recommendations to key stakeholders in the digital health sector? Dr. Larry? Okay. Unfortunately, it seems like we still cannot hear Dr. Larry. Okay, Mr. Okbeolua, passing over to you.
Thanks, Joyce, once again. I think I will just take from what Mr. Afis has also said. I think it really resonates with what I feel should be the final message to our audience, and it's cut across three main categories. For Nigeria to really start to see the benefits on our digital health, we need to continue to invest locally in our digital wheels. And when I mean digital wheels, I mean the standards that Mr. Afis also had also mentioned, the governance and incentives for even private actors and innovators to build upon. For policymakers, it would mean enacting regulations and, just like Mr. Afis said, mandating data exchanges across all our digital health systems. It would also mean creating budget lines for ICT operating costs as part of our national budget and even state budgets. For our healthcare leaders, what this would mean would be that, all our programs, we are appointing digital stewards, people that would continue to do to use these digital health systems in their day-to-day activities. It would mean our healthcare leaders budgeting for the devices. It would mean them budgeting for what would enhance connectivity and support the digital health systems after they have been deployed. And then lastly, for the technology developers, which some of our private sectors come in, it means we need to co-design, not just design for users, but design with users. It would mean we would need to work hand in hand with local users, because I believe systems that are born out of local realities are actually the ones that endure. And I believe if Nigeria can do this in the next 5 years, we can move from a fragmented donor pilot digital health system to a nationally sustained digital health ecosystem that would deliver equity, resilience, and efficiency. Thank you.
All right. Thank you, Mr. Okbeolua. To the audience, don't forget to put your questions in the Q&A box. We're passing this over to you again, Mr. Afis. Any final recommendations to, key stakeholders in the digital health sector?
My recommendation will attempt to summarize all I've said. So my recommendation is simple. One is, let's treat digital health as a core health infrastructure, not an add-on project. It's a core part of the entire health infrastructure. I think that's the first thing. If we invest locally in leadership, enhancing our human resources, digital health will naturally move from being donor-funded experiments to being backbone of a resilient Nigeria health care system that we all desire. So I think those will be my two immediate. That would be my final message to everyone. Over.
All right. Thank you, Mr. Afis. Dr. Larry, are you able to speak? Dr. Larry? Okay, it seems we still cannot hear Dr. Larry. So I am going to be moving to the Q&A. So we have a question, and the question reads, what innovative financing mechanisms has proven effective in attracting local investment for digital health solutions? And how can governments create an enabling environment to sustain these investments beyond donor funding? I'm going to go again. What innovative financing mechanisms have proven effective in attracting local investment for digital health solutions? And how can governments create an enabling environment to sustain these investments beyond donor funding? Mr. Opeolua?
I think we echoed that in most of our discussions today already. It is about really building the blocks for every other person to build upon. We need an enabling environment for digital health systems. And one of the things that we have mentioned throughout today is the fact that we need standards or interoperability standards that everyone can connect to. With that, we can unlock some of the benefits that we would see from our digital health systems, where systems no longer work in silos any longer. And with that, we would be able to eliminate indirect costs, just like Mr. Hafiz have said. I will not need to build from scratch any longer. Really, it's not necessarily about finances alone. Like I said, it is about even what is available. It's with an interoperability standards already being built, or a layer already being built with some level of building blocks or infrastructure already existing. High as a private sector stakeholder, or even as an innovator, would not need to start from scratch. We have seen a lot of times where you want to build solutions, you don't find an existing platform, but when you do find those existing platforms, they are closed systems that you cannot tap into. And that's one of the things that you see open source systems solving for us. So governments building on these standards, putting up open source solutions where people can then build upon, will help us achieve or get us to where we need to be.
All right. Thank you, Mr. Opeolua. Mr. Hafiz, this question is for you. This question is for Victory Ekbin, and they say, thank you so much to the panelists for the amazing insights. In Nigeria, telecoms and fintechs have transformed their sectors in Nigeria, and a lot of it is driven by local investments. What can we learn from them, and how can we bring the same energy to the health sector? Do you need me to go again?
I think that was clear. So it's really the lesson we can learn from how we've been able to advance our telecommunication and fintech, and how we could leverage the same thing for digital health. And I think it's still aligned with some of the points already around local investment. And I think one thing that has worked well for the telecom sector is that it's not just a high-tech solution, but it's something that brings value. It helps bridge the communication from, it is life for us because you are then able to communicate, you're able to do transaction from the comfort of your home, you're able to move money, you're able to do all of these things. So meanwhile, in digital health, we are yet to build the trust of our clients, in this case, the population, on how the solution that we are developing is making their life easier.
Yes.
And that's the point, which is why I'm excited about what EHA is doing and some of the work that we are also doing on the A side. Is how are we ensuring that technologies are not thought through from the lens of the developer, but more from the need of the community. Two, how are we ensuring that it's not standalone and it is integrating with something that's already work? And I want to look at a world where we have a solution that allows farmers to trade some of their produce for some lifetime health insurance cover. That way, everyone we actually want to key into the digital health because it's helping them solve a problem, right? So for me, we need to move beyond. The technology did not come to just build a structure. They came to help us address real life solution, real life problem, and give solution to it. I think in digital health, we need to start thinking the same thing. How are we bringing value to the most vulnerable group? So, and if we do that, we'll see ourselves go beyond the telecoms. Because at that point, it is the community that will then be driving our digital health. They'll be the one asking for more. Okay, to be like a child has mastered primary 2 and they need to naturally move to primary 3. But as it is now, we are just building solution for them and they are struggling to accept it on why it helped them. So I think that's the real way I feel we can learn from the telecoms. Over.
All right. Thank you so much, Mr. Hafiz. Dr. Larry, are you able to speak now? Okay. All right. We are still having some challenges hearing Dr. Larry speak. So we are going to be moving. Okay. Okay, so this question is for Mr. Okbeolua. Please confirm if you can hear me.
Loud and clear.
Okay. All right. So this is from Habib Ibrahim, and he says, "Good evening, all. I appreciate the discussion so far. Could you please clarify the strategies that can be employed to ensure that local investors remain confident in sustaining long-term digital health projects, especially in resources-limited settings?" I think we've already answered a little bit of this. Okay. Can you hear me, Mr. Okbeolua?
Yes, I'm just trying to understand what the person is trying to refer to, and not just repeat myself again. Around what we'll do about setting standards and all, but ensuring that local investors remain confident in sustaining long-term projects. I guess it's still, just like you said, we have answered it one way or the other. It's still just ensuring that we have that enabling environment for local investors to come and build, and then we have that resource available for them to build upon. If we are able to do that as a country, if we are able to achieve that as a country, I feel we would go much more forward. And I think maybe one of the things again that could come in would be the incentives for these local investors. So even when they build, we get to see tax reliefs or some sort of reliefs that comes from the government to investors that are looking at improving on our digital health sector in country. So I believe if we can do this, we should be able to ensure the confidence of local investors in the digital health ecosystem.
All right. Thank you so much, Mr. Okbeolua. Dr. Larry, please, I would like to confirm for the final time if you are able to speak before we move forward. Okay, so it seems Dr. Larry is still unable to speak. We have a lot of questions, but I'm just going to be taking the final one for Mr. Hafiz. And this goes, how do we bridge the gap of infrastructural needs, tools and internet, and digital health knowledge among end users of digital health in Africa?
Yes. So I think the question, I'll try and repeat the question. I can't confirm if I capture it correctly. I think the question is, are we looking to build the infrastructure gap for the end user? Is that the question?
Yes.
So I think the infrastructure gap need to come, but we need to start the solutioning from what are even the need that we have for the infrastructure, which is the first thing that comes to mind when we talk infrastructure is how we even simplifying the solution. I think when people hear digital health, the first thing that comes to everybody's mind is that we have some very tech application and all of that. Digital is as simple as SMS. Right? Technology is as simple as short message that you are sending. So how are we bridging the gap? One thing that we need to do is to first simplify what technology look like. Second thing now is that when you then need to have a particular solution in a place, you need to look at it from the lens of context specifics. And for us, if we are looking to bridge a gap, is how often must have it is. So let me look for a random example. If you are looking to, when the telecoms company that initial question asked, we're trying to improve their nets and widening the scale of their work together, the fintech. They ensure, MTN ensure that you do not need to visit their office before you buy data. Hello, can you hear me?
Okay. Yes, we can. Okay, Dr. Larry, can you just hold on? Let's finish with Mr. Hafiz, then we'll move to you.
Okay.
Thank you.
Okay. So they created a system that you do not need to visit an MTN office before you buy data. And the banks, every improvement the fintech company does is something that makes it easier for you to spend your money, basically, if we put it in simple terms. Meaning, we have more bank users now that you can send money from your house than when you need to go to the bank queue to send money. So if you look at it from the infrastructure gap, is bridging the gap start from making sure that the infrastructure you are taking care, especially in resource constraint area, is what is not far from what currently exists in that locality. And that's why I say for every time you are thinking about innovation, as much as you are thinking of the lens of the impact that innovation can make, you should also think on the back of feasibility of how well or how realistic it is for you to deploy such innovation in that area. So if I need to save the life of 100 women with IVI, and I know IVI cannot be given without a nurse and a midwife, I should not be thinking of taking it to a locality where they do not have enough healthcare workers. My priority should be testing it area where they already have HRH, and what just need is to build their skill to be able to use it. The same thing for all of the things we have said about digital health, in-service training, pre-service training. If you need to take any solution there, the solution should be designed to ensure that the infrastructure that exists in that place, what we have and what you are taking there, the gap is not so wide. And with little push, you can actually take it there. Because we are already resource constrained and you don't expect a lot of resources to be pulled from implementation into strengthening the infrastructure, especially now that we are grasping for fiscal year.
Okay, thank you, Mr. Hafiz. Dr. Larry, we have a question here for you. And the question is, how is the government approaching domesticated funding to support the transition to digital health?
Well, I think the government approach is first of all from the budgeting or creation of policy and the strategy for digital health to function in Nigeria. And as such, we are required to align with the government's priority. When we do that, then it is next for the government to provide the infrastructure. For example, government can create an opportunity for startups, for people who want to be innovative and create digital health platforms so that they can have the financial backing to start off something. And then we can have some incentivization for digital health platform initiators, as well as when an initiated intervention has been scaled up, they can be recognized, they can be incentivized. In that area, I think it will boost the morale and it will increase the progress in that aspect, as well as incorporating the digital health into the annual budgets that we develop. Right now, we were saying that digital health is not an addendum, but rather a part of the whole of the health system strengthening. So it should be able to occupy some space in the annual operation plans as well as annual budgets to be funded by government. And when we have the donors, the government should lead to harness all the resources that the donors are bringing and to prioritize the digital health. So I think with this, we can go ahead and implement the digital health and the technologies to enhance the health system. As well, the communities can do their best. Earlier, you have asked me whether there are some local examples that I can cite. Well, we have been reading, for example, in Rwanda, they have about 45,000 health workers, junior health workers particularly, and they train them and they engage them into reporting using GSM, SMS, to report health, incidents, to report maternal and child health cases, mortalities, birth, and everything. And this data is collected centrally and imputed into the country's health information system, and it is visualized all over using the dashboard. And real-time, response can be done with that.
Okay.
So this is an example. And as well, here in Nigeria, I know Bauchi piloted a program whereby the WDC, the traditional and religious leaders, were co-opted into agreeing on a digital health reporting system. And they did, and the WDC's World Development Committee members went ahead to sensitize, to create awareness on the use. And the cases were also reported. And that alert system make it possible for urgent and quick response. And through that, a lot of morbidities and mortalities were either diagnosed early and treated, and as well as mortalities prevented. So these are examples.
All right.
I think if government follow these channels by engaging everyone that have a role to play, I think we'll go miles.
All right. Thank you very much, Dr. Larry. That was quite extensive. We have one final question for you, and this question is from Chima Wadike. Please, we'll need you to keep the response very brief. And he's asking, is there any department in the Ministry of Health that serves as the Central Authority of Health Informatics?
Well, we have a department that we call Directorate for Advocacy, Communication, and Social Mobilization. We have the Monitor and Evaluation Unit, where we have the HMIS unit, and they coordinate these activities. And in Sokoto particularly, it has been a kind of vision that I have, to have the data control room that reports real-time data. And just like we had been discussing, once you don't carry people along, you create programs and activities, they are likely to fail. Because when USAID, IHP are moving out, they donated about 244 desktop Android phones for reporting for health facilities, one per ward.
All right.
We kept one at the one functional facility per ward. When there is serious attrition, people went with the phones, and the communities could not sustain.
Okay. Thank you so much, Dr. Larry. We are out of time. So I would like to give, each of the panelists, 30 seconds for final words. And we'll start with Mr. Okbeolua.
Okay, I've done that before, but just to say that I believe digital health ecosystem in countries is becoming much more promising. We just need to stick to what we're doing right now, look for ways to expand based on all of the things that we had earlier mentioned on this call. And I believe in the next few years, we will start to see improvements in how our public health space actually evolve. Thanks.
Thank you. Mr. Hafiz?
One. I think for me is that we should all know that partnership needs to be anchored on values, and everyone needs to play their role. The government needs to provide the enabling environment through policy and accountability. The private sector continue to bring in the efficiency and innovation that we need. And the development partners continue to as the catalytic funder. But the glue that should bring everyone together should be the alignment with the contextual priority. Because without that, partnership will lose its direction, or it will just continue to lead us to inefficient spending. So I think those would be my key takeaway. And my last message for everyone on this, on the shared value and the dependent role everyone should be looking to play. Over.
All right. Thank you so much, Mr. Hafiz. And Dr. Larry?
Yeah, so
30 seconds.
At the end. Yeah, I would like to go on sustainability. Sustainability in that we harness our own resources at home. The withdrawal of Trump have taught us a hard lesson. And so we need to get our own finances, harness what we have locally, and deal with it. And as well, you have to carry the communities along. Once you do anything, you don't carry the community members, that program is likely to fail. So community participation is for paramount importance, while sustainability, we have to harness our own resources.
All right. Thank you so much to everyone, the panelists, the audience, the organizing team. Thank you all for staying and being a part of this insightful webinar. Don't forget to follow us on our social media handle for more insightful information. And I would like to, appreciate each and every one of you for joining us. Thank you and see you next month, same time next month. Bye.
Thank you. Bye-bye.
Bye, everyone.